Hello and welcome to the Aesthetic Insider Show. I'm your host, Angela O'Mara. I'm here today with Dr. Laurence Rifkin, a cosmetic dentist who practices in Beverly Hills, California. We're going to talk today about a really important subject, oral cancer and how to detect it. But before we get going on that, I would like Dr. Rifkin to introduce himself to our audience. So Dr. Rifkin, welcome to the Aesthetic Insider Show. As always, it is such a pleasure and an honor to have you here with us today.
Thank you, Angela, and to all your guests. I'm glad that you tuned in because I think today is one of the more important topics that we can talk about that affects lives, not just smiles and things like that. Angela, you know that you and I have talked about celebrity smiles and many other topics of art, cosmetic surgery, but the foundation of cosmetics should always be on health and longevity. And in dentistry, most people think of dentists as somewhat doctors of the mouth, very limited. Usually teeth are more involved, but you don't understand, or at least most people in the public don't understand, including my patients until they're educated, that we have the opportunities to enhance your health through many different avenues and to detect and prevent serious diseases along the way. So I thought today's topic, and you and I agreed upon this, is that oral cancer is a very serious topic. All cancers, of course, are serious. And the way that I want to approach this, and of course you'll be leading the questions, is to talk about, number one, the incidence of it, the detection of it, the prevention of it, and the treatments of that. And so you can lead any way you wish as far as the Q&A, but I think your audience will appreciate the fact that they can now be more educated on protecting their own health, the health of their family, and especially their children in today's world. So I am here for you. We'll talk about other fun things, but this is an important topic, and it will lead into other ways of detecting the link and understanding the link between oral and systemic diseases.
That's great. And I agree with you. I mean, it's like the foundational health is, of course, is what everybody is striving for and hopes they have, but it's not always the case. And we have talked before about, the oral aspects of the human body and that kind of being the gateway through the teeth, through the mouth to, things from the outside world, and just being careful about what we're actually putting into our mouths is so important. But I think let's just start with, like you said, number one is what is the incidence rate? How prevalent is oral cancer in relation to all the other types of cancer, that we are struggling with as humans?
Okay, well, that's a good starting point. Well, the good news is it's extremely rare. The bad news is it can be seriously debilitating, if not mortality is involved with it. So in the United States, in the last couple of years, the incidence of detected, it doesn't mean that there isn't more, this is what is detected, is about 50 to 60,000 people per year come down with some form of oral cancer. That could be on the lips, it could be on the tongue, it could be in the cheeks, it could be in the throat. And the mortality rate of that is about 20%, about 11, 12,000 people die from oral cancer per year from this particular rate. And most people don't see victims of oral cancer that at least are in the survival mode, because a lot of them have to have radical surgery, removing parts of their jaws, faces, etc., to try to halt and cure, if there is such a thing, or put in remission the oral cancer that does occur. So you don't really see these people walking around the street because it's quite debilitating and facially scarring. Also difficulty with chewing and eating and swallowing and all of those things that we just take for granted every day. So that incidence, I don't know what it is around the world. Obviously, it's going to be much higher if you look at numbers of the population. But it is, the statistics show that probably twice the amount of men come down with oral cancer for various reasons. Usually the age starts to be detected in men about the age of 60, 65. It does occur in younger people from the ages of 35 and upward. The causes, there are numerous types of oral cancers. There are cancers that are caused by the obvious that most people know, smoking. The tobacco has carcinogens in them. The heat, all of that changes the cellular composition and causes a stimulation of overgrowth of cells and mutations. That's called squamous cell carcinoma. There are types of cancer that are caused by not only tobacco, but alcohol, vaping. I think the vaping is kind of new, but just please, everybody remember, the only thing that should be going in your mouth and your lungs is air and food and water, okay, and beverages, not any other foreign substances. The other types, it can affect the salivary glands. It can affect the base of the tongue. It can eventually spread to the lymph nodes. And that's usually at a later stage because it's very difficult to detect certain areas of oral cancer. It is still possible. But usually people that kind of come in and say, hey, there's a lump in my throat or I can't swallow so well. And those are later stages of oral cancer that hopefully could have been detected earlier. And when it gets to the lymph nodes, then treatment becomes a little bit more extensive. You have to have surgery. You have to have removed lymph nodes. You may have to have chemotherapy and radiation. Yeah. And in that process of the surgery, depending upon the extent and spread of the oral cancer, can cause more tissue needed to be removed. And with radiation, has its side effects as well. Radiation reduces saliva flow. And so people are constantly needing to drink water because it's difficult to swallow with a mouth that's dry. The other kind of causes of oral cancer are HPV, really, really important topic today. Fortunately, for those people that are younger, let's say, than perhaps 35, when the first HPV vaccine came out, children are now seeing a lower incidence or zero incidence of HPV-related oral cancers. If they still smoke, they're still going to get squamous cell carcinoma of the mouth. Those of us that probably were too late to get the vaccine, I think they're starting to see if vaccines will work on older population, but they're probably saying no, because most of us are exposed to this particular virus, an HPV, human papilloma virus. We're mostly exposed to that, along with herpes viruses and many, many, many other viruses. And the good news is that most of us clear and pass that particular virus without incidents and future problems such as oral cancer related to HPV. HPV can be passed on through contact. It's usually personal contact through kissing, sharing saliva, and a high incidence of sexual-related contact. It usually, if it's oral, you're going to have to think about this and put it in perspective clinically. It's oral genital transmission of this particular virus from another body to your mouth, okay, into the saliva, and it changes things genetically. So sexual behavior and sexual partners and all of that needs to be part of the behavior modification, along with eliminating smoking, reduction of alcohol. Alcohol is drying. It does have, in large quantities over a long period of time, it does have a relationship to oral cancer. So, smokers, I don't want to say alcoholics because that's a different type of disease, and I'm very empathetic with alcoholism. But these particular chemicals, no matter what we think about it, have an effect on oral tissues. And so we have to think about the causes. Also sunlight. If you're out in the sun a lot, you can get oral cancer on your lips. So sunlight is another way to acquire a skin cancer, okay? If it's on the lips, we will call it related to oral cancer. So obviously sunlight, viruses, alcohol, tobacco, these things are causative of relationship of oral cancers and different types of oral cancers as well. And remember, it just doesn't stay in your mouth. It does travel through lymph nodes and through the rest of your body, and you can get oral cancer cells in other parts of your body like any other type of cancer. It metastasizes, and sometimes the bad thing is sometimes it's detected at a later stage. And so now treatment becomes more radical if you haven't had the vaccine.
Yeah. Now, let me ask you a question in terms of, an understanding of the types of cancer that are out there. How would a person know without an examination if they have oral cancer? Because sometimes it's really difficult to know you have it until really it's kind of too late or it's become so invasive.
Exactly. So this is like somewhat of a continuum of my thrust. Ever since I was in dental school, we always went to what we called a tumor board rounds of observation and learning in the hospital, patients that had different types of tumors. So dentists have been trained in dental school to recognize tumors even outside the mouth. Our normal routine, and it's usually taught in dental school to hygienists and dentists as well, as to do what we call an extraoral and an intraoral examination of the mouth. So every 6 months, my patients are required to come in, if they will, and most of them do, because they understand, they're educated, how important it is for me and my hygienist to do an extra and intraoral examination. So what does that mean? We palpate or feel the lymph nodes and salivary glands that are under the jawline and down the neck. Okay, also the thyroid gland. We can feel little lumps or bumps that are abnormal or asymmetric. Symmetrical bumps are usually so. If everybody's freaked out right now and they go home and they start to feel under their jaw, if they feel symmetrical bumps left and right and they feel equal, that's probably normal structures. It could be a salivary gland. You can get enlarged lymph nodes from having a sore throat or different types of infections. Doesn't necessarily mean it's oral cancer. But if there's any question at all, see your physician and see your dentist. Now, what is a physician going to do? They're going to look in your throat with a tongue depressor and things like that, but they're probably not going to look as thoroughly as your dentist and hygienist, who are looking at every part of gum tissue around every tooth, under the tongue, on the back of the throat, inside the lips, everywhere that we are able to see. And we can only see so far back in the throat. So if we see a white patch or a red patch or something growing there or something that's been there for a long time, it's not going away, okay? If it's not related to a tooth infection, we might want to refer that patient for evaluation with potential biopsy to an oral surgeon and a pathology report, just to make sure it's nothing serious. If we detect it early, this is really good news, that usually treatment is minimal. It's usually slight, small excision of a small little piece of tissue. If they feel that they need to do a PET scan or anything else to evaluate lymph nodes, great. Just make sure you're clear of it, because the negative results of letting it go and ignoring it and say, hey, it's fine, doesn't bother me, can be serious. And so every 6 months, my patients come in. They usually come in every 3 months for cleanings, and I also highly educate them on oral hygiene, because eliminating bacteria, viruses, microbes, etc., from your mouth has a huge impact on your systemic health. And you know, you and I have talked about that. We wrote an article together a few years ago on enhanced oral hygiene, from when you brush, when you floss, how you use a mouthwash, the timing of doing all that to prevent bacteria in your mouth from being ingested either into your stomach, inhaled into your lungs, or they actually penetrate through the gums tissue epithelial cells adjacent to the teeth, and they go into your bloodstream. And medical science is now obviously recognizing the relationship and importance of oral hygiene and oral bacteria, which do penetrate and circulate throughout your body, and the relationship of atherosclerosis, diabetes, early birth rate, from heart attacks to pulmonary embolisms to a stroke. Many, many other diseases are related to that. And you know, as you said early on, that the mouth is one of the biggest portals of entry of bacteria into our bodies. And so the early detection, to go back to your original question, how do you do this? The doctor, meaning either physician, but better the dentist and the hygienist, seeing you on a frequent enough basis to detect things early enough so that treatments can be minimal and they can help you survive this, clear it, and not have things that metastasize to the rest of your body, or not have to have radical treatments. So that's my recommendation. One of my tips or pearls would be to see your dentist and hygienist every 6 months. Always have them do an oral cancer head and neck screening. Takes a couple of minutes. That's all it takes. If something is found, detect it, take a look at it, biopsy. It's 99% of the time, it's going to be nothing. But 1% of the time can be serious to your life. And that's why I say the statistics of 50, 60,000 people per year are detected with it. There probably is 3 times that amount, 4 times the amount that goes undetected. And so,
I mean, what I find interesting is, when you talk about your treatment, not your treatment, but the routine that you do in terms of doing this oral examination. I think all of us have had, whether it's a little bump on our tongue or a little bump, on the cheek, internally in the mouth. There's always been something that, but then you kind of mention, like, looking around the teeth and looking in the gums is, I don't think that many people would be thinking like, oh, is my gum tissue areas where a regular doctor clearly would never look, but a dentist does. And so I just find that really fascinating, because I think many of us, like I said, have had certain things where, we think, oh, it's nothing, it'll go away. Whereas,
right, you don't know what you don't see.
You can monitor things and see if there is a change, and determine whether it is actually a growth versus a food reaction or a sore throat, or something else.
That's true. But, dentists, we deal in minutia. We deal in the level of cellular microns and millimeters. Other doctors deal with, and giving them all due respect, they're just in a different area and with different requirements. Yeah. There are other techniques and methods that we're trying to help us detect things sooner. There's things called the Vel scope, which is basically swishing of a little bit of a dye and looking through a special light to see any changes in epithelial cells. Dermatologists are doing that. There are laser treatments, and we're trying to find vaccines or treatments for oral cancers when detected, to reduce the amount of debilitating morbidity and surgical radical surgeries and radiation and chemotherapies, to eliminate those terrible side effects that can occur with some of these treatments. So Vel scope, that's another method. There's also something that we're using in my practice, not only that scope, but also something called oral DNA. Oral DNA is an assay, meaning an evaluation of all the bacteria that in your mouth by just having a little saliva swab. And so we get that back in about 5 days to let me know, anybody know what type of bacteria are living in the mouth and what the percentages are. There is a certain amount of normal biofilm that's in your mouth, okay, or biome that's in there that needs to be there, and that's not pathological. But there are some bacteria that should be cleared because they can lead to some serious oral and potentially systemic diseases.
Oh, that's fascinating. I didn't know there was an oral DNA test. So
yeah. We use that usually for periodontal diseases, but also there's a specific test for oral cancer markers. There's also, I go to the doctor too. I get my blood drawn, and they check for inflammatory markers, for cancer markers. There's a lot more sophisticated technology related to the potential of detecting some of these serious diseases that ever was before. And so don't think it's just, riding up on the horse and carriage and checking out your, listening to the stethoscope in your heart, and that's it. There's a lot more sophistication today in medicine and dentistry.
Yeah. So do you have any examples of patients where you have detected a cancer that has been able to be treated,
Yes.
easily because it was an early cancer, versus a patient who maybe has had a more aggressive cancer and required more aggressive treatment?
Yeah, I have a few examples, and I probably have more. And the fortunate thing is I've been practicing, as you know, for over 40 years. And so I've seen thousands, tens of thousands, maybe hundreds of thousands of appointments and patients in my career. And the good news is I probably, in a handful, I can probably count on one hand, 5 incidences of patients that have been found to have early or late stage oral cancer. So I'll give you, and the times that I do send patients to have it detected, again, 90% of the time, it could be some other type of autoimmune disease, things called geographic tongue, and a lot of other things, and little things that may be to be ignored, and it's really nothing you can do about it, and it's really not a problem, to things that have had a patient lose half of his jaw. A patient of mine was a 2-pack-a-day smoker, and he was my patient for about 5 years. He moved to Florida. I hadn't seen him for 10 years. During his term with me, everything looked normal. I go through my normal routine. 10 years later, he calls me up from Florida, and his wife calls me up and says, so-and-so, he had a tooth pulled, he had a tooth extracted, and 6 months later, it's still not healing. And I said, that doesn't sound right, okay? I said, what's the dentist say? He said, well, let's watch it a little longer. I said, no, this is not a time to watch it anymore. It's gone too late. Usually an extraction site will heal within a few days to a few weeks and without incidents. I said, go to an oral surgeon. That did happen. Oral surgeon detected squamous cell carcinoma, usually probably from the smoking. And in that period, he had to go get part of his jawbone resected or removed and have a rib put in and facial scarring, lose half of his tongue. And you can imagine what a nightmare that might be for him.
Yeah.
And so he went and fortunately found a doctor that did robotic surgery in Maryland, in Baltimore, and a very fine doctor, and supposedly was in remission for a few years. A few years later, it happened to his upper jaw. So some of these things are not, it's just not a great thing to have happen. And had he been in my practice, I don't know. I think I would have acted immediately after a month if something's not healing, go in there right away. Yeah. What the outcome would have been for me or anybody else detecting it earlier, I think it would have been better. Surely it would have. I've had another patient that had a little red spot on the side of her tongue. It wouldn't heal. I said, you know what? It doesn't look like anything. Let's just detect it. So I sent her to the oral surgeon, and the oral surgeon did a biopsy, a small little size of probably a pea or a peanut, and it was removed, and it was precancerous, early cancer, but non-invasive yet. The lymph nodes were clear. She goes back every 6 months. She checks it out. So far, nothing has spread. So that's a win. Okay.
That's great.
And I've had a couple other patients. I think that's probably enough examples where early detection would probably reflect early treatment and better outcomes, if not cure. But at least none of that horrific surgery would have been required. And she's very good about it. So again, regular visits to your dentist and hygienist, that will always do a very 2-minute extraoral and intraoral examination with lights, whether they use an oral DNA test, whether they use a Velscope, but at least clinical knowledge, understand oral pathology to know what these things look like. I go into the dermatologist, you might see a freckle, and it might be something more serious than a freckle. You need to understand what the differences are. So those are 2 examples, at least, of patients that, fortunately for me, most of the patients never had anything serious, but 1 or 2 did. One was a good outcome. One was a pretty serious outcome, bad outcome.
Now, we talk about like lifestyle changes, which are clearly, an indication for just general health as well as oral health. In no smoking, alcohol, whether it's limitation of alcohol or certain types of alcohol, foods, the different things that people can they can change those lifestyle habits. Is it possible through better dental hygiene, like at-home hygiene, if you kind of have any of those bad habits at home, oral hygiene can help with prevention?
Oral hygiene has its part too, relative to probably other causes of oral diseases.
Yes.
It's not going to cure the cancer due to tobacco smoke.
Yes.
It's not going to cure alcohol abuse. It's not going to cure vaping if that has an effect. And it's not going to cure sexual behaviors that can transfer HPV viruses.
Yes.
That it can't do. But there is many, many other much more common diseases that are related to health that oral hygiene definitely has an impact upon. Okay? So...
And what would those be? What would those be?
Great. Okay, so just understand, everybody, please, that bacteria and mechanical stress are the causes of breakdown of teeth, gum tissue, and bone around the teeth. So bacteria causes infection. It causes inflammation, which causes the body to react and bring in blood cells, cause gingival bleeding, cause bone loss of gum tissue attachment. All of these things can be related to toxins created by bacteria that just sit and live in our gum tissue and on our teeth. They also produce acids that decalcify, demineralize the surfaces of enamel or tooth structure, causing what we call a cavity. Okay, we call them caries, but it's cavity due to the demineralization. So the bacteria and viruses cause local and systemic diseases. Also, this infection transfers through, like I said earlier, through the epithelial cells adjacent to the gum tissue. Amazingly, we don't think of bacteria and viruses as having brains, but their mutation rate allows them to readapt continuously, just like the flu or any other virus. Yeah. So they actually can produce a chemical. Imagine epithelial cells lined up inside the gum tissue that's adjacent to the tooth. And they all kind of stick together with some polymucosaccharide types of proteins, as well as sugars that cause the cells to stick together. Otherwise, we'd fall apart, right? So bacteria and viruses have created a chemical that kind of dissolves the connection between the cells. What does that do? That opens up the doors between the cells for the bacteria now to go into your bloodstream through your capillaries and circulatory system and lodge in other places in your body. So they have found in coronary arteries and other arteries, when we look at plaque, that's the cholesterol plaque that accumulates inside the wall of an artery. It's like a hotel for bacteria. Yeah. So bacteria also penetrate in there and then grow. So now this plaque, which is already reducing the size of the blood flow, it is now reducing it even more so with the inflammation of the bacteria. That is the same bacteria in your mouth that came from your mouth and went through your bloodstream and lodged inside your arteries. Now, sometimes that bacteria will grow like a pimple on your skin. It'll grow on the inside of the artery, and sometimes that little pimple, we call it an eruption. If it's on your skin, you wipe it away and maybe it'll heal up. Inside the body, in the circulatory system, that eruption of bacteria and plaque leads to a blood clot, which we call an embolus, and that blood clot can cause a stroke, heart attack, pulmonary embolism in our lungs. So we have to understand the relationship and the causes of oral and systemic diseases by oral hygiene, forgetting the oral cancer that's just local right there, but terrible. But these other diseases that are related to oral bacteria must be considered to be a hygienic opportunity to eliminate from your body to reduce the chances of getting systemic diseases related to oral bacteria. So how do we do that? Okay.
How do people at home, how do they really incorporate great dentist recommended, oral hygiene into their daily life?
Well, most of us probably take a shower daily, hopefully. Okay. So we're into cleanliness and good smelling bodies. Okay. We have to eliminate toxins that come out through perspiration, the dirt that accumulates on our skin. We think nothing of doing that daily.
Yeah.
But you have to think about that. That's not quite as serious as bacteria on the inside of our mouth that go into our bloodstream or lungs, because, when we sleep at night, we usually lie backwards, right? So if we don't clean the bacteria out of our mouths, the saliva they're filled with bacteria are now aspirated, inhaled into our lungs, and now we're self-inoculating our lungs with bacteria that are in our mouths. So what's the relationship? And that's what, if you remember when we wrote that article, I talked about enhanced oral hygiene with COVID coming along. We want to do everything to eliminate bacteria from our hands. We were washing our hands and wearing masks and all of this stuff. And there's a message there. So I thought about how we can even improve what I've always taught to my patients. Brushing and flossing alone don't kill anything. They do debride. They do remove a lot of the bacteria or plaque that supports bacterial growth, because that's their food, but it doesn't kill them. So I enhanced into that a mouthwash that I think is the most mild and effective mouthwash that has two ingredients, basically, is the most important, fluoride and hydrogen peroxide. You can have alcohol in a mouthwash, but that's usually more drying and could be, in extreme cases, perhaps related to oral cancer. Yeah. So I'm recommending fluoride, hydrogen peroxide. Now, there are other antimicrobial ingredients, chlorhexidine, that can be placed, but those are usually staining products. So I believe that hydrogen peroxide is well documented, fluoride is well documented, that are anti-cavity, antibacterial, and what you cannot remove mechanically with a toothbrush and dental floss could be killed with a little bit of mouthwash. So there's lots of little tools, lots of little tips on how to do that. I have a big educational program in my office with my hygienists and my patients of how to clean effectively. Everybody should read the article that Angela wrote from our interview for me to outline what the steps are. There's basically 8 steps. And it's from washing your hands to using the floss to dipping your toothbrush in the mouthwash to kill the bacteria that's now on your toothbrush, and all the different steps. I'll leave you to follow that little article. And I also, in my Instagram, have an example of me in the bathroom brushing and flossing my teeth and using the mouthwash as a kind of a visual demonstration. But that's super, super important, how to do it and when to do it, especially before you go to bed, because you don't want to inhale bacteria in your saliva into your lungs. And I have a 5-point checklist that I give to my patients every time we go through. We want to track patients' improvement or non-improvement every time they come in. I also have developed a report card to try to help my patients understand it. I have a little QR code on my little report card so that you can access Google Drive documents on what periodontal disease is, what oral cancer is, what you can do to reduce the chances of oral and systemic diseases. I think it's so important in dentistry and medicine that we educate our patients, educate ourselves and our patients of how to prevent as best possible the diseases that we are exposed to.
Yeah. You said you have a 5-point
checklist every time.
Yeah. So what?
Yeah, checklist.
Points?
Nobody has a good enough memory to remember everything. So I used to be a pilot. I used to fly, and I used to fly off a checklist. So every pilot deals with a book that has a checklist: how to start the pre-flight, to starting up the engine, to communicating with the tower, to takeoff, to fuel management, to navigation, to before landing. Better put those gear down before you land. Otherwise, you're going to be landing without wheels, okay? So there are 100 steps. And so I've broken it down so my hygienist and I never forget anything. So my 5-point checklist involves the patient comes in, what's their medical history? Has anything changed in the last 6 months? Do they have any chief concerns? Does anything really bother them? I always want to listen to my patients and understand what their chief problem is, because I may see 5 other things that are maybe more important, but in their mind and their emotions, they want to fix this, and that's fine too. We got to do it all. We can walk and chew gum at the same time. Then I also check their for oral cancer screening. Then I also check for their periodontal health, what the pocket measurements are and why we measure pockets. Then I check their restorative. Is anything breaking down? Then I check their bite and their TMJs. All of that, and if there's any incomplete treatment, it's all listed down. The patients are reminded every time. Reminded, motivated, identified, and that's also supported with the photography that I do to show them their mouths and their x-rays on a PowerPoint that I create for every patient. So that's my 5-point checklist, enhanced with some visual cues and visual support from pictures and x-rays on my big monitor and screen. And we go through a great understanding of, how to take care of your mouth, what's good about your mouth, what could be improved about your mouth, what we need to do now, and what you might be thinking about later, how you can prevent problems.
Now, in terms of at-home general health, or at-home oral health, I should say, is there anything that parents can do with children? I mean, of course, it's like, brushing their teeth every night, and, but kids can be difficult, and especially with flossing and that type of thing, but just things to begin to set good oral habits.
That is a super question, because this education should start earlier in life. So habits built early on, right? It's hard to take somebody my age and teach them new habits, although with enough motivation, yeah, I can learn anything. So there's different types of communication. So I speak to my patients as I would want to hear it myself. If you don't have a dental degree or you're not into science too much, I have to kind of break it down into more basics. So yes, first of all, monkey see, monkey do. Show your children what to do. The next thing is understanding that if you're sharing food with children, which often parents do, you're sharing the bacteria back and forth. So children can get the bacteria that's related to decay, called strep mutans and strep aureus and streptococcus mutans. These are types of bacteria that cause decay. That's the bacteria that produce the most acids. So if you're kissing your kid and you're sharing food, you're giving them the bacteria that's causing cavities. If you happen to have a herpes cold sore in your mouth and you have that virus and you're kissing them, you're going to give them that forever bacteria, that gift that lasts forever, okay? If you're kissing your husband, your wife, your kids, whatever, you're sharing DNA, so to speak. So you have to start early. You have to make them understand that bacteria in our mouth are living organisms like we are. We eat food, we process food, and then we usually go to the bathroom, okay? Or we do go to the bathroom all the time, and that's how we eliminate it. Hopefully, yeah. Bacteria have no other place to go but in your mouth. So I kind of break it down, and forgive me for saying, sometimes I tell patients, if they don't get and they're not motivated by the science that I just told you, I say, bacteria eat the food that we eat because that's in your mouth, and they pee and poop in your mouth. So sometimes that visualization, that cue kind of is disgusting, but yeah, I'm going to brush my teeth right away and I'm going to floss. So communication is important, and starting early. It's such a good point that pediatric dentists and parents should be supporting this good habit, this lifelong good habit of oral hygiene.
Yeah.
Also, nutrition.
I brushed my teeth before we got on our call today, but I think I might have to go do them. Go do it again, and just to make sure.
Yeah, absolutely. And there's a lot more information. I know this is a really nice time that we've been able to spend. And I'm here, more podcasts, whatever. There's more to talk about nutrition. There's so many other topics to build your habits, to understand the importance of prevention. It'll save you tens of thousands of dollars of dental work, unnecessary preventable dental work, just by investing the time with prevention, seeing the hygienist, seeing the dentist at least twice a year, and most of us 4 times a year. Doesn't cost that much, okay? And I have patients that I love when they come in here and I do my recare examination and with my hygienist, and they say, "What do you think, Doc?" And I said, "I don't know, your mouth's boring. There's nothing to do here." So they love to hear that. It's the best thing they could hear.
Yeah, yeah. No, I know, like you mentioned, like you would then, of course, if you did detect anything in the mouth that could possibly be an oral cancer or a major concern, you, of course, refer them out to a physician or a family physician for further treatment and exploration. And I don't know if talking on during this particular podcast, if this is a time to talk about treatments for oral cancer, because obviously it's not simple and it depends on the cancer, the type of cancer, the patient, and you've given 2 examples of 2 forms of treatment, one with a patient that didn't have too much of a problem and she's continuing to be monitored, versus somebody who you hadn't seen in 10 years and they had a significant treatment for their oral cancer. But are there any other things that you can share with our audience about treatments, and not necessarily that you do them, but they are treatments that are available?
There are new things coming out all the time, as we know, in medicine, all types of treatments for different types of Alzheimer's or cancers or heart disease and things like that. So the traditional treatments that we know is we try to cut away the bad cells that are growing out of control, cancer cells, by surgical excision, cutting them out, sewing it back up, trying to reconstruct the area, breast cancer, oral cancer, any other kind of cancer, skin cancer.
Yes.
The other ones depends on, again, the diagnosis, how far the cancer has progressed. Does it require chemotherapy? Kind of like that shotgun, let's just flood everything and try to kill the bad cells, and hopefully all the good cells will still survive. The other one is radiation, trying to be focused on a local tumor and try to kill just that area and leave everything else untouched and unaffected.
Yes.
Keep it healthy. There are now, and is related to oral cancers, I can't say that I know what's being done in research in all of the universities and all the hospitals in the world on immunotherapy. But I know that some of my very good colleagues and doctors on head and neck surgery at UCLA and USC and other institutions in Baltimore and throughout the country, they are trying different approaches to reduce the amount of surgery, reduce the amount of radiation because of the side effects and chemotherapy. And so there's immunotherapy, there's different types of drugs, there's different types of vaccines. But when you detect cancer, depends on whether it's local or whether it starts to spread and how far it's spreading.
Yeah.
If it's one lymph node here or here, sometimes it's just the lymph nodes. You have a PET scan. You look for any other tumors in the rest of your body. If it hasn't metastasized and it's just staying here and here, you take care of those 2 areas, depending upon the number of lymph nodes and how far it's spread. If it's very local, it's minimal treatment. If it gets bigger, it starts to now become radiation, excision, and possibly chemotherapy.
Yeah.
I wish we were smarter than that. We can cure cancers, but they're working on it.
But yeah, we're getting closer, hopefully. Well, this information is absolutely phenomenal. And I know, is there anything we have not covered in terms of oral cancer, how to detect it?
Well, just the best ones to detect it, I think, are going to be your dentist and hygienist, and we work together as a team. Then also the oral surgeon is the one with biopsy and a pathology report, should it need to be evaluated further, are the best ones to determine if it is cancer. If it is cancer, then we have to determine how far has it progressed and what the treatments would be. The best thing to avoid all that, number one, is early detection, even if it is cancer, because the treatments become easier and better outcomes. The best thing is prevention. If it's HPV, vaccination of your children, okay, up to a certain age. I don't know if the age is now up to 17 or it goes now a little bit beyond. So it keeps changing. So, but at least if you had children, that's probably going to be part of their vaccination protocols. And that's huge. Then the other things that are helping reduce that amount of DNA transfer related to HPV is obviously sexual behavior. So understand that all the diseases, more than just HPV, human papillomavirus, which causes cervical cancer in women, can now occur orally. It's just where the viruses go.
Yeah.
The rest of it is reducing the things that are causing carcinogens, which are chemical, which could be alcohol and tobacco, and sunlight. Excessive sunlight can cause obviously changes in cells, skin cancer, lip cancer, and progress inside the mouth. The rest of the diseases that are caused orally or by your general run-of-the-mill, thousands of different variations of bacteria, viruses, and other microbes that are not just bacteria or viruses. There are more. There's fungus, and there's often types of cells that cause diseases. So oral hygiene can help reduce that amount of bacteria that's in your mouth, better behaviors, avoidance of certain types of chemicals and carcinogens. And then again, of course, keep your immune system up.
Oh.
Be healthy. Okay, healthy lifestyle, sleep, exercise, better nutrition. Okay, who you hang out with, I guess. I don't know what else. And those are all important factors for general health lifestyle to be the best you can be and live the longest with the least amount of these worries and anxieties about what you're going to get.
Well, Dr. Rifkin, this information is fascinating, and I'm sure many of our viewers will really cherish just what you have so openly shared with us. And thank you so much for being on the Aesthetic Insider Show. It's always an honor and a pleasure to have you, and I'm sure we'll do another podcast at some point in the future. So thank you so much.
And thank you so much for giving me the opportunity. I love every day educating my patients on the one-to-one scale. This is such a nice venue to reach out more to the masses. Continue those people watching out there. Continue with your dentist and your hygienist and ask them more questions. How can I prevent this? What about oral cancer? What are you doing to detect it? Do you see anything? Should I go see an oral surgeon if you detect something? So please consider oral and dental health as a full body systemic health preventative process and a good habit to encourage. And thank you for asking such great questions.
Right. Thank you. And for those of you still with us, remember to watch next Wednesday for another exciting episode of the Aesthetic Insider Show.